Welcome! The Pediatric Eating and Swallowing, or PEAS project is a provincial quality improvement initiative with the purpose of developing clinical pathways to standardize and improve the care of children with a pediatric feeding disorder. In this session, we will focus on how to develop an oral feeding care plan that supports a completed Go Wheel. This presentation was created by Beverly Collison, Christine Gottas, Liz Matthew, and Melissa LaChapelle as part of the PEAS Standardized Practice and Education Working Group. An oral feeding care plan is a living tool to communicate safe strategies between the feeding care team, parents, and other key caregivers to ensure consistency. It is important to remember that a feeding care plan does not replace the clinical assessment. Remember to share the care plan with the family and other key providers. The multidisciplinary team and family collaborate to create a care plan. It is then shared with everyone who supports care, including family and other key providers. The care plan can be used at any point along the patient journey, that is, during an initial visit, when there is a significant change in the treatment plan, or when there's a transition to another service. To find the care plan on the PEAS website, click on For Providers and then Feeding Care Plan under Clinical Tools and Forms. The goal wheel is a form to capture the client goal and list the actions required to achieve it. It is an expression of the family's long-term hopes and provides context to the oral feeding care plan. You can order copies of the goal wheel and/or care plan from Data Group. They are also available to fill out and print directly from the PEAS website. The forms are both available through Data Group as carbon copies so that you can provide a copy to the family. In Connect Care, the goal wheel can be found in treatment planning activity for outpatients. For inpatients, you can find it under Collaborative Goals and Treatment Plan Goal Flowsheet. For the oral feeding care plan, we hope to build an electronic version in Connect Care. At this time, you can document this into patient instructions by building a smart phrase, or you can scan the paper copy and attach as a clinical document type under the encounter level. This hypothetical case scenario illustrates the use of the goal wheel and the oral feeding care plan. Elsie is a 4-year-old girl who will be attending daycare. She has a pediatric feeding disorder that includes dysphagia. Given her medical history, an instrumental swallowing assessment was done and the video was shared with the parents. Sharing the video with the parents helps them understand the physical swallowing challenges and risks. You may want to pause the recording to read it in full. The goal wheel completed at the beginning of the service sets the stage for the remainder of the service. Every goal wheel is unique. The goal wheel helps the clinical team to understand the family's context and what success looks like from their perspective. The actions listed in the goal wheel can be broad and are intended to guide next steps in tandem with the oral feeding care plan. In this example, the team and Elsie's family came together to create a plan and identify specific strategies and recommendations to smoothly transition Elsie to daycare. In their eyes, the parents want Elsie to be healthy and safe and have the opportunities to play and make friends despite her medical and feeding challenges. As you will see in the next few slides, the goal wheel and the oral feeding care plan are synergistic. These tools help the clinical team to work with the family to meet their goals, provide consistency, and improve outcomes. The sample goal wheel and care plan are both available on the PEAS website as a handout under Clinical Tools and Forms. The next two slides highlights the oral feeding care plan as it was created for Elsie. You may want to pause the recording to read it in full. The care plan summarizes Elsie's medical and feeding needs and lists the specific strategies for safe and successful eating. The sections on page 1 address medical conditions, allergies and precautions, emergency contacts, food and drink consistencies, preparation, and diet. Page 2 of the oral feeding care plan provides further specifics, that is, techniques, positioning, utensils, strengths, abilities, and preferences, contact information for the team, and who the care plan is to be shared with. Families have really appreciated being part of the conversation to set goals and a care plan, and receiving a documented copy that they can refer to and share with others. Providers have also found these documents enhance care. This is new learning, and it might take a while to integrate it into your practice. And that's okay, just do your best to persist. Remember to update the goal wheel and care plan whenever there is a major update or significant life changes which impact the plan. Recognize that it might be difficult with different systems and paper, but if the family has a copy, then they can be the ones to have the latest copy to share with clinicians they see. Adding contact information will be helpful too. You can contact us by email or using the PEAS contact form on the website. Please also consider subscribing to upcoming news and events through the website, and also subscribing to our community of practice. Thank you for listening to this presentation. We hope it'll be helpful as you incorporate the oral feeding care plan into your practice.